Good day. My name is Marius Miguel Vismonte and I am a student nurse from San Beda University, and today I will be demonstrating the nebulization process. Before anything else, the first thing that we need to do is to gather appropriate equipment, including the appropriate aerosol device, which is in the form of a generator that can either be a small volume nebulizer, a large volume nebulizer, or an ultrasonic nebulizer. And then after that, we need to secure the power source, which we have here, that serves as the mechanism by which the generator operates or is actuated. So we're going to plug in our nebulizer. And then after that, we also need to prepare our interface that includes our mouthpiece, which we have here, and also our face mask that we have here, which will be used in the latter part of our demonstration. And then afterwards, we also need to prepare the prescribed medications and also the isotonic, sterile isotonic diluent, which we have here. So this is the medication and this is the sterile isotonic diluent. And then after those things, we need to prepare the other materials. That includes the syringe, which is here in our bag, the gloves that we also have here, and also the stethoscope. We also need to prepare the disinfectant pad and antiseptic pad. And then optionally, we can also add other materials like the peak flow meter, face mask, gown, oxygen blender, which is used in times that built-in adjustable oxygen controller is not available, and then also a nose clip. And then after preparing the materials, we're now going to keep in mind to avoid any kind of distraction or interruption when preparing or administering medication in order to prevent medication errors. And then afterwards, we need to verify the doctor's order, which we have here on the bedside. So we're going to verify the doctor's order, which is salbutamol Duavent for the patient. And then after verifying, we need to compare the medication label on to the order, which can be seen in the patient's medical record, which we have there. So we're going to compare the medication label to the order in the patient's medical record. So ipratropium salbutamol Duavent nebules. So with that, we also need to check the label, which is attached here in the nebules itself. Salbutamol Duavent. And then after doing that, we also need to check the patient's medical record if an allergy or contraindications to the prescribed medicine exists. So if the patient has some allergies or contraindication that exists, we need to, we're not going to administer the medication, and we immediately need to notify the attending physician. In this case, our patient is not allergic to the medication or there are no any contraindications, so we can proceed. And then after that, we also need to check the expiration date on the medication. It says here, December 2021. Double check on the inside. December 2021. In cases that our medication is expired, we need to return it to the pharmacy and obtain a new medication. And then afterwards, we need to visually inspect our solution for any particles, discoloration, or any loss of integrity. And we need to keep in mind not to administer the medication if the integrity is compromised. So we're going to check the solution if there are any presence of particles or discoloration. So in this case, our medication is in good condition, so we can now proceed. Afterwards, the next thing that we need to do is to label all our medication and medication containers, and of course other solutions. And we must keep in mind that in handling such things, we must use the sterile technique to prevent cross-contamination. And then afterwards, we need to settle or discuss any unresolved concerns related to medications together with the patient's doctor or attending physician, so that we may discuss what are the appropriate plans of action that we must conduct. And then after that, we need to perform hand hygiene. In performing hand hygiene, we can either use an isopropyl alcohol or the soap or the typical water. The difference between both the soap and the water works with visible stains that we can see in our hands, and in this case, there are no visible stains in our hands, so we're going to use the isopropyl alcohol. Apply generous amount and observe the proper steps. And after doing so, we need to confirm the patient's identity using at least 2 patient identifiers according to the facility policy. So, good day ma'am. My name is Marius Miguel Vismonte, and I will be your nurse for today. May I ask you po, what is your name?
Casey Vismonte.
Okay ma'am Casey. May I ask also for your birthday?
June 25.
Okay, thank you ma'am. Now that we're able to identify the patient, we're now going to explain the procedures to the patient, and we will also discuss to the patient the possible adverse reactions or potential adverse reactions and any other concerns related to our medication if it is her first time taking this kind of medication. So ma'am, today I will be performing or giving you the process of nebulization, so that you will have an easier airway. It will assist you in your breathing, so that it will resolve your issues, including the difficulty in breathing. And of course, we're going to administer a medication which is Duavent, that will help you in the breathing process. And then afterwards, we need to put on our PPE, or also known as the personal protective equipment, as needed to comply with the standard precautions. And then afterwards, we need to obtain the patient's vital signs that can include temperature, the blood pressure, the heart rate or pulse rate, and the respiratory rate. And also, we need to auscultate the patient's breathing sounds, so that we will establish a baseline comparison for the later another assessment. And then afterwards, if possible, we're going to place the patient in a sitting or high Fowler's position, which promotes or encourages lung expansion, and it also promotes the dispersion or the expansion of the aerosol within the lungs. So I have my patient here, and we will assist her in the sitting or high Fowler's position. So ma'am, I will... Now that our patient is in the high Fowler's position, as I've mentioned earlier, we need to auscultate to hear her breathing sounds. So we have our stethoscope, and we're going to auscultate our patient to obtain her breathing sounds. In using the stethoscope, we need to warm the diaphragm so that the patient won't feel shock if we're going to apply it in the skin. But in this case, we're going to do it and asking the permission of our patient, ma'am, Is it okay if I move your clothes?
Yes.
Ma'am, I will ask you to inhale and then exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Now after doing that, the next thing that we need to do is to attach the nebulizer tubings to the attachment of the compressor, which we have here. We need to set these things aside. Now our tubings are pre-attached, and then we must get the chamber, and we must keep in mind to keep the chamber cup in the upright position. And then the next thing that we need to do is to draw up the prescribed medication and inject it into the nebulizer chamber and add on the prescribed amount of normal saline solution or water, or clean or sterilized water. So in this case, we need our syringe that I have here, and then our medication, of course. So we're going to open the nebule and then discard. Get an appropriate amount according to the doctor's prescription. And then we need to add a sterile normal saline solution or a sterile water. Especially when we are dealing with pediatric patients, but in cases that we're dealing with adults, we can give the whole nebule for the process of nebulization. So for demonstration processes, I will add a normal saline solution or a sterile water. And then we're going to open the chamber cup and then place the solution. And then after that, we need to discard. The next thing that we need to do is to either attach the mouthpiece or the face mask or the mask for nebulization, or any other delivery devices that will be attached here in the nebulizer. So in this case, this one is the mouthpiece that we can also use. So after attaching the mouthpiece, the next thing that we need to do is to make sure that the flow meter is attached to the gas source. And then after doing that, we need to attach the nebulizer to the gas source and adjust the flow to 6 to 8 liters per minute, and to promote the adequate functioning while preventing the excess venting. And then after that, we need to check the outflow port of the nebulizer to check if there are adequate misting. So we're going to check it. So as you can see, there are adequate mist. Now that we have confirmed that there is an adequate mist for our nebulizer, we're now going to assist the patient with the mouthpiece or the mask that I will demonstrate later and instruct the patient to grasp the mouthpiece securely, making sure that it is clean and well sanitized before we give it to our patient. And then we need to instruct our patient that using her teeth and lips, she needs to hold in or grasp into the mouthpiece. Ma'am, using your lips or teeth, you need to grasp well in our mouthpiece. And then afterwards, you can use your hand, ma'am. And then after that, with either the delivery system, either the mask or the mouthpiece, the patient should intake slowly through her mouth and hold each breath for at least 1 to 5 seconds before exhaling through her mouth. So we'll begin the nebulization process. Ma'am, you need to inhale slowly. And then hold at least 5 to 10 seconds each breath before exhaling. And then after that, we're going to try also the mask, which we have here. Remember that this area is a sterile field, so it is okay to put down some equipments. So again, we need to assist the patient, but this time we're using the mask. It is a different delivery system. We must make sure that it is well fit and our patient is comfortable with the suiting of the mask. Ma'am, are you comfortable with the mask po? And then again, we will now begin the nebulization. And then throughout the process, we need to remain with our patient during the treatment until all of the medication on the nebulizer has been aerosolized. So the whole process takes up to 15 to 20 minutes, and let's say that it is already done. And then let's say that it is already done. The next thing that we need to do is to take the patient's vital signs, and again, we need to assess the lung sounds in order to detect any adverse reactions towards the medication that we have just administered through the nebulizer. So ma'am, now that your nebulization is done, I'm going to assess again your breathing patterns and breathing sounds through auscultation. So again, we need to warm the diaphragm and then begin the auscultation. So again, it's just the same pattern, breathe in, breathe out, following the proper pattern of auscultation in the lungs. And then after that, we must remember or take down note any changes that we have noticed. So the next thing that we need to do is to encourage the patient to cough and expectorate or suction any mucus formation as necessary. And then also we need to assist our patient with oral care, and then we also need to clean and change the nebulizer cup and tubing as appropriate, and it is essential in the process of preventing any bacteria buildup. So we're going to clean this one. We need to disassemble and put it aside in order for us to clean it later. And then after doing so, we're going to dispose all of the waste appropriately, since we have our trash bin here in our side. So dispose. And then after disposing, we need to remove and discard our personal protective equipment. And then again, we need to perform hand hygiene. And after that, we need to clean and disinfect our stethoscope using the disinfectant pad, which I have here. In disinfecting our stethoscope, we begin with the diaphragm. And then the bell. And then discard. And then we also need to clean the earpiece. We can also clean the tubings. And then after doing so, we need to keep our stethoscope within the bag. And then again, we need to perform hand hygiene. After doing such things, the last thing that we need to do as nurses is to document any finding and data that we have gathered. And then after we document it, we also need to document the procedure that we have done. And then again, we provide aftercare, bring back the patient to her position that is comfortable for her. And then again, provide privacy by closing the door, reinstalling the curtains, and etc. So this is again Marius Miguel C. Vismonte, your student nurse. Thank you for watching and God bless.